Aphorism 254. The other new or increased symptoms, or on the contrary, the diminution of the original ones without any addition of new ones, will soon dissipate all doubts from the mind of the attentively observing and investigating practitioner with regard to the aggravation or amelioration. Though there are among patients persons who are either incapable of giving an account of this amelioration or aggravation, or are willing to confess it. Explanation. In this aphorism, Dr. Hahnemann has given idea about how to draw the doubts, the other new or increased symptoms which suggest aggravation and diminution of the original symptom without development of any new symptoms which suggest amelioration. By observing all these conditions, all doubts are cleared in mind of alternatively attentively observing and investigating practitioner regard to the aggravation and amelioration. Though there are patients who are incapable of giving feedback regard to aggravation or amelioration, or they are unwilling to confess it. Aphorism 255. But even with such individuals, we may convince ourselves on this point by going with them through all the symptoms enumerated in our notes of the disease one by one, and finding that they complain of no new unusual symptoms in addition to these, and that note of the old symptoms are worse. If this be the case, and if an improvement in the disposition and mind have already been observed, the medicine must have effected positive diminution of the disease, or if sufficient time have not yet elapsed for this, it will soon effect it. If now the improvement delay too long in making its appearance, this depends either on some error of conduct on the part of the patient, or on other interfering circumstances. Explanation. In this aphorism, Dr. Hahnemann has given idea about how to draw the doubts. When the patient is not able to give you report about aggravation or amelioration, or not ready to confess anything, then we can convince ourselves regarding effects of medicine by going through our notes in which symptoms are noted in last visit one by one. We should find here that no new unusual symptoms has been developed, and not even aggravation of old symptoms are there. With that, if there is improvement in the mind and disposition, the medicine must have effected positively with diminution of the disease. If sufficient time have not yet given for this, it will effect soon. If the medicine selected is perfectly appropriate, still the improvement is delayed too long by its appearance, it may be due to some error of conduct on the part of the patient, or some other interfering circumstances.